Can ICU stays lead to medical trauma? Imagine being in a place where everything feels unfamiliar and out of your control. That's often what patients experience during an intensive care unit stay. While ICU care is essential for saving lives, it can also be a source of psychological distress that leads to medical trauma. Medical trauma refers to emotional and psychological responses to medical events that are overwhelming or frightening. When someone survives a critical illness and spends time in intensive care, they might develop post-traumatic stress disorder, or PTSD, which is a serious mental health condition. Research shows that nearly 20% of ICU survivors develop PTSD after their stay. Some studies even suggest that up to 30% of patients who experience distressing events during ICU care may develop PTSD. Considering that around 270,000 people are admitted to ICUs each year, this means thousands of survivors face ongoing psychological challenges. The trauma often comes from the intense environment of the ICU, which includes unfamiliar medical equipment, loud alarms, and unfamiliar faces of healthcare workers. Patients often feel helpless because they cannot control their bodies or the medical procedures happening around them. Invasive procedures like breathing tubes, known as tracheal intubation, and suctioning can cause physical discomfort and psychological distress. Patients are often immobile, in pain, and may have trouble sleeping or experience sensory deprivation. Conditions like delirium, which causes confusion and hallucinations, and sedation can make communication difficult and increase disorientation. All these factors combine to create a sense of fear and helplessness that can linger long after leaving the ICU. PTSD symptoms usually develop within days to 6 months after the ICU stay. To be diagnosed with PTSD, symptoms must last longer than 1 month. If symptoms last less than 3 months, it's called acute PTSD, while symptoms lasting longer than 3 months are considered chronic PTSD. Sometimes, symptoms may not appear until 6 months or more after the trauma, which is called delayed onset PTSD. Common signs include intrusive memories or flashbacks of the ICU experience, avoidance of places or situations that reminded patients of the ICU, and hyperarousal, which involves being easily startled or feeling constantly on edge. These symptoms can greatly affect a person's daily life, making social interactions difficult and increasing healthcare costs. It's important to understand that medical trauma from ICU stays doesn't only affect patients. Family members are also at risk. About 1/3 of family members of ICU patients experience PTSD symptoms, especially if the patient dies or if they feel they were not given enough information during end-of-life decisions. Healthcare workers in ICUs also face psychological stress from their exposure to critical situations. PTSD after ICU stays often occurs alongside other mental health issues like anxiety, depression, or even substance use problems. These co-occurring conditions can make recovery more complicated and affect overall well-being. Despite how common and impactful ICU-related PTSD is, it remains under-recognized in many healthcare settings. Medical teams tend to focus on physical recovery, sometimes overlooking the emotional and psychological scars that can develop. Understanding that ICU stays can lead to trauma highlights the importance of providing psychological support alongside physical treatment. If you or someone you know has experienced a critical illness requiring ICU care, it's crucial to seek help from mental health professionals. They can offer therapies and strategies to address trauma and improve quality of life. Remember, everyone's experience is unique, and recovery involves both body and mind. Always consult healthcare providers for personalized advice and support.